What's up? Doc Mike. Public Health on Call. By Johns Hopkins Bloomberg School of Public Health. Today's topic for May 8, 2021. A digital problem with an old school solution. Thank you, Johns Hopkins Bloomberg School of Public Health.
Welcome to Season 3 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, I'm speaking to Dr. Anna Robert, Director of Primary Care for the San Francisco Health Network and an alumna of the Johns Hopkins Bloomberg School of Public Health. The network's 14 clinics texted many of their patients with a link to a web form to make an appointment for the COVID-19 vaccine. What could possibly go wrong? Let's listen. Dr. Robert, thank you so much for joining me to talk about COVID vaccination efforts in San Francisco. Let's start with the goal. What was your goal as you started to vaccinate people through the San Francisco Health Network?
Our goal was to make sure that the communities who had been most impacted by COVID-19 infection had early, easy, accessible access to the COVID-19 vaccine.
So you wanted the people who were getting COVID, their friends, their families, their neighbors, to be able to be vaccinated quickly.
That's correct. Yes.
What was the first thing you did to try to make the vaccine available?
The first thing we did to make the vaccine available was to make sure that we had locations set up where in the neighborhoods that needed them.
And then you set up a website for people to sign up for appointments?
Nope. So then we sent out a web form for patients via a text that would then take people to a web form to sign up and schedule an appointment at one of our locations.
How did that go?
It went awry. It was a challenge. So initially, about 12% of our patients signed up for an appointment. Then we saw a lull, and then all of a sudden, our slots were full, and we looked at our schedules, started looking at where the patients actually lived and resided and who their healthcare providers were. And we saw that our web form had gone viral, had been posted on social media, and people from all over the Bay Area were scheduling to get vaccine appointments in our clinics.
So let me get this straight. You have clinics located in communities where people who are at very high risk for COVID live. You sent your patients a text message, and before you knew it, people from the entire region were signing up for appointments.
That's correct. We had close to 800 people from both outside of San Francisco and then also on the northern part in the zip codes and the neighborhoods in San Francisco who were the least impacted by COVID were signing up to get COVID vaccine with us.
So that was not what you intended?
It was not at all what we intended, no.
So what happened essentially? I mean, what was the problem with your sort of phase one of outreach?
I think that we underestimated how challenging a web form would be for our patients to navigate. We underestimated the vaccine frenzy of people who are just so desperate for the vaccine that even though the web form asked them to attest that they belong to our system, they still signed up for it. But we were able to act quickly. We canceled all of those appointments.
Got it. And so how did that go over, canceling the appointments?
We had to very challenging few days. We sent an email to people explaining to them that they had, been forwarded a web form that they were not authorized to receive. And then we made sure that we had really strong managers running our clinics to be able to have those really tough conversations with people who had driven from all over the city and all over the Bay Area to come get vaccinated with us.
Got it. So you moved pretty quickly to stop the people who were not in your neighborhoods from getting the vaccine that was intended for people at very high risk.
Yes.
And so then you just turned around and sent out another web form text?
No. So then our clinical staff, realizing what had happened, they're super committed. Our front office nurses, our medical assistants, they doubled down and they started working their list and calling all of our patients who were eligible to get them scheduled and to get them to come in. And we scheduled almost 900 appointments manually over the course of a few days.
So you wound up using an old technology instead of a new technology to get in touch with people. I mean, it's possible that people might have concluded just from the text messaging that maybe your patients didn't want to be vaccinated. But when you called them, you found out that in fact they did.
Yes, in fact they did, and the part of the problem was that even if they did call us to make an appointment, all the appointments were filled by people who the vaccine was not intended for in the first place.
So that sounds like it took a lot more staff time to be able to reach people.
Yep. So it did. It was very labor intensive. And so, after we sort of got through those initial few days, we reconvened as a group to understand how we were going to pivot and shift to get our patients in.
And now a little bit more time has gone on. How did that, version 2.0 using San Francisco lingo, here, how did that version 2.0 turn out for your community?
So it's going okay. So what we started doing was to just text our patients, letting them know they're eligible, encouraging them to call to make an appointment. And then we also opened up our vaccine sites to be drop-in clinics where they weren't going to need an appointment, so that they could come when the time worked for them. And we offered the drop-in vaccine clinic 7 days a week as well.
Wow. And do you have a sense of how many people in your intended group have actually gotten vaccinated?
Yep. So as of now, 74% of our patients over the age of 65 have received at least one vaccine. We're working on our patients who are over the age of 16 right now. And we are at 53% of our primary care patients who have been vaccinated.
So how do you feel about those numbers?
We feel really great. We feel really good about those numbers.
And so what do you think we can learn from this? Do you think this sheds some light into why there are such enormous disparities in vaccination in many parts of the country?
I think that what we've learned is that we have to be very intentional in ensuring that we are providing low barrier access to vaccine, that there has to be some sort of criteria and eligibility screen that's a part of being able to receive a vaccine at specific events or clinics that are intended to serve communities that most need it.
So operating so many drop-in clinics, what have you learned?
Yeah, so we've learned a lot of things along the way. One is that we need it requires more line management, staff to just sort of manage the crowds, to collect information from people as they arrive. The benefit of an appointment system is that you can collect all that information before the person gets there. So you really need to invest in that. It's hard to predict how many people will show up. So really monitoring the number of vials and doses that you have open, and then having a plan for what you're going to do at the end of the day to ensure that your extra doses continue to go to the people they're intended for, not just for friends and family of people who might be working there. there needs to be a pathway for people with mobility issues, small children who may not be able to wait in line to sort of to move to the front. And just today, we launched our EPIC team, our electronic medical record. They just created individual links to schedule one appointment. And so instead of us collecting all that information when people get to the front of the line, we're giving these individual links to every person as they're waiting so that they fill it in. And so it's almost as if they're presenting with an appointment by the time they get there, which really allows us to move through the process really quickly. We just started that today. It's really exciting.
Could you talk a little bit about the vaccine hesitancy that you're seeing and what your strategy is for overcoming it?
We're seeing that, and we're looking more closely at this data as it comes out, the percentage of patients who decline or want to postpone the vaccine stratified by race. And we're seeing that it is mostly our patients of color who are Black, African American, and Latinx patients who are have a lot more questions and may not quite be ready for the vaccine yet. So we're listening to them and trying to provide forums for learning and listening and support, and really just messaging that when people are ready to get vaccinated, we'll be here for them. And in the meantime, we'll continue to educate and work with our community partners to be leaders in getting the word out.
And are you seeing some people come around?
Yes, actually, and we're seeing it in our own staff too. We do have team members that initially were had concerns about getting the vaccine, who I think after months of hearing and seeing their coworkers and other family members getting vaccinated, who are deciding, okay, I'm going to do it today. I say probably at least once a week, I hear a story like that.
So looking forward, do you have hope and optimism, or are you nervous about being able to reach enough people in your community?
I have hope and optimism that if we are able to be patient and provide the information that people are seeking, that we will be able to get enough people vaccinated within our communities and our patient populations.
Great. Dr. Robert, thank you so much for joining me.
Thank you.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, C.N. Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.